Healthcare facilities are beginning to feel the pressure as the third wave threatens to sweep across the country. South Africa has recorded over 8,000 new COVID-19 cases for 3 days in a row now. And if that's not enough, 2 million J&J COVID-19 vaccines will not be released for distribution in the country due to the contamination issues at a vaccine plant in Baltimore in the US. Acting Deputy Vice-Chancellor at the University of KwaZulu-Natal, Professor Mosa Moshabela, joins me now to discuss what this means for our country. Professor Moshabela, I'm not sure if you heard much of what the President just said, but our situation really seems to be quite dire, particularly because of our huge reliance on the J&J vaccine, and of course the production has been set back significantly. What are your thoughts?
Good evening, Omar, and to the viewers. Indeed, I did hear a little bit of what the President said, and I do think that he's really speaking largely to the long-term, kind of goals of what we need to do in South Africa and in Africa in terms of manufacturing, which is really wonderful. But you are absolutely correct that we are right now dealing with an urgent situation, an emergency, if one might say, of dealing with the third wave and at the same time needing to expand our vaccination concurrently. And the news that we have received, both in terms of the increasing caseload, the shortages of beds, especially in Gauteng, as well as the need to dispose of 2 million doses of J&J, it's a major setback to what we've been doing. And we really need to focus on what we know works.
So, I mean, when we think about options for us, I mean, the President, one bit of good news, but I think we've still got a timing issue here, is that the Aspen factory can restart production. I think midweek, he said probably by Wednesday, and he's been in touch with the CEO of Aspen. But the point is, starting up production still requires them to receive the ingredients of the vaccine. Remember, this is fill, as they say. That's what we do at the Aspen factory. We don't manufacture, we don't create the chemicals. We fill and then we distribute. And I spoke earlier to Helen Rees. We're not yet even in a position to use the Russian Sputnik vaccine, the Chinese Sinovac. So we really are left with just the Pfizer. And as the President again said, he went cap in hand to the President of the US and said, we need more of that donation quickly. It looks like we're going to have to be beggars here.
No, absolutely. I think that we have a number of issues in terms of the vaccines. The first main issue that I see is that we've lost a big chunk of one-dose vaccine, J&J, that we needed to boost our supply. And in fact, at the end of June, this number was going to start to increase rapidly, exponentially in terms of supply. But this is not going to happen. And I suppose that it will take quite a number of weeks, perhaps even a month, for the manufacturing in Gqeberha to basically boost our supply in South Africa, and they also need to boost supply elsewhere. It's not just for South Africa that they are manufacturing for. But when it comes to Pfizer, the one challenge that we have here, in addition to losing this huge supply of J&J vaccines, is that most people who were vaccinated so far and will be vaccinated until the end of the month, they need to receive their second dose. Because Pfizer is a 2-dose vaccine. So a lot of the vaccines that we are currently getting now, we have to slow down in terms of new jabs for people to make sure that we can adequately cover people who need to be vaccinated with the second dose. And this has to be managed carefully, logistically, by the Department of Health and all the partners that are involved in the vaccination. So this is where I see another major setback, because it's going to reduce the number of new people that we will bring on board onto the vaccination program, unless if we get more Pfizer vaccines, and that supply is not guaranteed.
But Prof. Moshabela, let me ask you to look at this strategically. If you had to review how we behaved as a country around this absolutely critical resource that we need, what would you say were the biggest lessons we've learned? What did we do really badly? What did we do really well?
Omar, I think that we did really well in terms of doing our own research in South Africa to identify the variants of the virus that would be responsive to the type of vaccines we use. The approach in South Africa, in as much as it's frustrating, and it's been frustrating even for me, in terms of choosing vaccines, is that it has really focused on trying to find the vaccines that would be that would be able to work against our local variants dominant here. Now, that's an important step to establish, but what that has done, it has resulted in delays in making decisions, which is really the problem that we have had, because then, strategically, it made a lot of sense to actually focus on vaccines that would work locally. But on the other hand, we had anticipated the problem of bottlenecks. So we did not do a good job in terms of anticipating and managing the bottlenecks that we expected would happen, even though we may not have known exactly what, which is why from the start, some of us were saying, let's use whatever vaccine we can get our hands on from the get-go. And we did not do that. So in a way, it's a hit and miss situation whereby now we're finding ourselves having to slow down even further after much delay, because we're not having supplies due to things that we can call unexpected events. We can't blame government per se for what has happened with J&J, but all of these things are circumstances in the global supply chain that are likely to affect us. And this is not going to be the last of it. We must expect that we'll have more of this kind of situation. But I also think that we did well, Omar, in terms of securing the enough doses for the country. In terms of getting the 31 million or 32 million doses from J&J and the 30 million or so doses now with an additional 15 million of Pfizer. But the issue now is that we are locked into these contracts. It was good. It assured us we knew doses were coming. But now we are locked into these contracts, and we don't necessarily have a lot of room in terms of getting new vaccines. So if we were not locked into the contracts, we could say, well, let's abandon J&J, let's go for another type of vaccine. We can't quite do that. Mm-hmm. So these are things that, on the one hand, it's a positive thing. On the other hand, it creates problems that we have to manage. So we are in a situation, Omar, whereby the vaccination program is not going to save us from the third wave. We must just accept that we need to deal with the third wave currently and the rising cases based on the prevention methods that we normally work with, including having to really consider more restrictions and even thinking about restrictions around borders in order to manage the third wave while we sort out the global supply chain for vaccines, which I think will certainly benefit us towards the end of the year, where perhaps we might be thinking that a fourth wave may arise. So it's a mixed batch, Omar, of good strategic things and poor strategic decisions, because we did not necessarily make sure that we've got contingencies in our approach.
Thank you very much for your analysis, Professor Mosa Moshabela, who's UKZN Acting Deputy Vice-Chancellor.